everybody, and welcome back to another episode of... I completely botched this intro.
Is that what it's called?
I don't know running. I am completely lost right now.
Brought to you by PT Sports Pro.
Brought to you by TBC. Blah. I am lost.
I give you 2 months off.
I know.
And you
I'm going to restart this.
Man, I like this intro.
This will actually be a blooper one. Hello, everybody, and welcome back to another episode of the I Don't Know Running podcast, brought to you by PT Sports Pro. I'm Lewis, and I'm a self-admitted lazy ultra runner. Nailed it.
You sure did. You know, that's the part. I thought you were going to go into some other, tangent, but no. It's just the end part. So this is Mitch, and I'm not happy to be back.
I'm Dave, clinical manager at PT Sports Pro.
And Terrence Rubin with PT Sports Pro, bringing you another episode of You Don't Know What You Don't Know.
I apparently do not know the name of this podcast.
Well, we can refresh you. It's been a long summer, a beautiful summer at that. And, coming back after about a 2-month absence, it's great to be back on the show, sharing information and getting down to some nitty-gritties of how we can live out our fall days, right?
Well, let's live out the summer ones
The rest
first.
of the summer, please.
Yeah.
Let's not cut that off too early.
We have at least a month of summer.
True.
Maybe more. I mean,
judging by the temperatures out there, hopefully more.
yeah, it has been hot.
Yeah. So how's your summer's been, Lewis?
Well, mine has been good. I wanted to get through the whole Western States thing. That was my focus when we entered into. Brian was in. I wanted to get through that in a healthy way, be able to the whole knee thing has been kind of sitting back there, figuring out timing wise. Again, now this is an insurance issue, when to do that.
Right.
And so at any rate, I tabled that. I was feeling healthy. I have felt good throughout the summer running. And then I went and did the Mummy. And for those that listen to the I Don't Know Running podcast this morning, this most recent one, I did injure my ankle. I rolled it about mile 10, and however, it's feeling a little better. And so I've ran once since, but it's just tender on the outside, up high.
Well, you know what? You're going to segue into some stuff that we're going to discuss today. So perfect that you
Perfect that I hurt myself. Is that what you were going to say?
The best timing on injury. What about you, Mr. Mitch? You're back in town. You've been running away from us the whole summer. What's going on?
Terrence and I have become really good friends. I've been seeing him quite a bit before I left on my trip. But it's been about almost 2.5 weeks at least since the last time, and then I've running. I paced Laura, and then I ran a race in Idaho,
Utah. Utah Hills.
Yeah.
Somehow I took Idaho Falls and turned it into Utah Hills.
We were listening to it in the car.
Close enough. It's about the same, right?
We're listening to the car, and Tammy's like shaking her head. I'm like, make sure you text him.
And she did.
Yeah. So you're staying pretty healthy, though.
That I've been doing a lot of hiking over the last week, more than that, and oh my gosh, I think it's worse with hiking.
Yeah.
But my calf is not tight right now. That I was hitting that with a massager this morning. That's fine. It's just in the Achilles itself that's painful right now.
Yeah, and that's kind of why I wanted to ask you guys how your summer's been, and I understand there's been some injuries floating around, and we're all, as we get to this part of the season, we've gotten through like that really hot June, July. Some of us may have scaled back some of our training. Some of us have added a whole bunch of family stuff that we get to do that we got to then also superimpose onto our training plans, which oftentimes the training plan will fall apart. And so it's kind of nice to see where you guys are at, injury-wise, health-wise, and also just in terms of general timing. Because we're starting to see a bit of an uptake at the practice now with people that are finally getting deeper into their training programs and are injuring themselves. There's a couple of Ironman races coming up in the next couple of weeks here, and then we've got fall marathon season coming up. So we thought it would be interesting to talk about, what kind of injuries are people dealing with right now is it different than those early season injuries? And then what can, the general athlete do to help mitigate some of these things? At which point do you kind of reach out to someone, get some help? So Dave, you've on your end, on your schedule, you've been seeing a few of those athletes coming in as well, right?
Yeah, I've definitely seen a few, in particular, where it's been a nagging injury, where someone's had something that's been going on a while, and they sort of know in the back of their mind that they need to get in and they need to do something about it because it's not going away. And so many of them that finally are saying, "Yep, time has come. I need to get this taken care of."
Yeah, and the exciting thing that's happening at PT Sports Store right now is that we're actually getting in network with all these insurance companies.
Yeah.
So we finally got Blue Cross, we've got the Aetnas and a bunch of the other smaller insurances, of course, Medicare, Medicaid. But we got the Blues last week, and we made an announcement about that. And we've actually had an influx of athletes that are now coming to see us with their injury issues. And quite often it's sad that it has to be something like that makes someone trigger that, hey, I need to get this taken care of. But more often than not, the sooner that someone comes to see us post-injury, the easier it is for us to actually help them. The longer they wait, then we're dealing with something that becomes more chronic, and then that becomes a problem, trying to get resolved quicker.
Yeah, I'm wondering, well, two things. Number one is, and then I'm just thinking in my head as you were saying that, as they procrastinate coming in, could then potentially, I'm guessing, create other injuries. But the thing that you initially said, boy, I am having a really good day today. I'm thinking, that's what I wanted to ask. What is as you get into this part of the season, I already kind of am thinking a certain way, but I would just want to ask you, when people get into the meat of their training, what is the most common injury that you're seeing coming in, or the purpose or the reason for that injury?
Yes, that's a great question, because there's a grouping of injuries, right? You have your primary injuries and you have your secondary injuries. So beginning of the season, the primary thing, the first thing that you injure, you're going to come in, you want to see us. But now we're dealing with a group of people that ignored the primary injury and they've developed secondary injuries. And so what we're seeing is someone may come in with, let's say, hip pain, but their problem is actually their low back that they ignored at the beginning of the season. And as they try to compensate for the low back issue, the hip got jacked up, or take any injury, any joint, any muscle. That's what we tend to see. And so shame on us for looking just at what they're complaining about. We actually have to delve back to the story as to where did it start and address all those components. So I think the message, again, with this podcast today is just to help people understand that when you have an injury and you wait long enough, the injury may feel better, but you may have issues developing in other muscles and other groups. And sometimes the other muscles or other groups of injury that you would have may not even be on the same side. It could be in the opposite side. It may not even be in the same limb. So let's say you hurt your hip or your low back. You may find that your left shoulder, the opposite limb, starts to bother you because you have to run differently and move differently. So when you get to see an expert on these kind of injuries, they really should be diving into you as a whole and what are we seeing in terms of balance or imbalance. There's no, from what I've been seeing in the practice, and Dave can back up what he's seen on his end, I've been seeing a bulk of like hip and knee injuries right now.
Yeah.
And when I'm seeing the knee injuries, they seem to be stemming from an ankle or calf origin issue.
Okay.
And when I'm seeing the hip injuries, they seem to be stemming from an origin knee issue. So it's kind of like moving up the chain.
Yeah.
So based on and that progression, in the late fall, we're probably going to see a lot more back injuries because of not addressing the segments below that.
Yeah, totally. Yeah, I've seen a few hip injuries for sure. I've seen a lot of calf injuries. And that, to what you were saying earlier, it's so essential to dive into obviously what the issue is, but then bringing it back in time, because, maybe 80% or so might be the calf is the issue and they're in the issue that we need to treat. But then a good handful are their low back or their hip that is then resulting in the calf
Yeah.
and having a problem. So it's, you can't always zero in on an injury and say, oh yeah, I've seen this before. This is here.
Yeah,
Not
and so
necessarily.
in the progression of that injury, so for example, with you, I know you've been dealing with this knee issue like for quite a bit of time,
Yeah.
and you haven't really done much to address it. It's kind of like you've taken some time off.
That's it.
Yeah. Well,
That's the only thing he's done.
That's the part of the lazy ultra runner
Yeah.
syndrome, right?
And he talked to you and he mentioned it to you. That was,
That's good enough.
that's good
yeah,
enough,
isn't
right?
that good enough?
My words can sometimes heal. And that's for you. We have created the hashtag, but did you die? Sure.
Yeah.
I mean, it's on my sleeve. Did you see
But
that?
I have not died yet.
No, but I think, so has that progressed to any other body part yet?
No.
Or have you had, like, so for example, you said you rolled your ankle, right?
Hmm.
Which ankle did you roll?
It was my left, and it was
And which knee do you have issues with?
right.
Okay.
yeah. The ankle was purely a trail.
Mhm.
I stepped on a rock
Mhm.
because I had already went through 10 miles of very difficult trail. And then I got on a runnable section
Mhm.
and then let my guard down a little,
Except for one rock.
except for one rock, and I rolled on it, and it was a significant enough roll for me to take notice.
Yeah.
You know how you roll something and you're like,
Yeah, and
oh,
you're
I
like-
caught myself.
Yeah.
Right.
But this one was enough. I didn't catch myself, and you know how you can kind of feel it sometimes. So it was enough that I knew, okay, this could potentially be an issue, but it shook out,
Mhm.
and I finished the race, and then it seemed fine until a few days later, something like that. So this
Mhm.
was on a Saturday, probably Tuesday-ish. I was sitting in a chair for a specific or a certain way, kind of with my ankle rolled out.
Mhm.
And man, when I got up, I about fell down.
Yeah.
It hurt so bad.
Right.
Well, you're not in your 40s anymore.
I am
changes.
not. I am barely out of them. Thank you.
Whatever, you're not in your 40s anymore.
Only one of us is.
Only one of us.
Yeah.
I am.
So, but it's interesting again that happened to be a coincidental kind of injury, but that's quite often what we'll see as a secondary kind of injury, where you have a right knee issue. You're favoring the way you run in a certain way, where you just take more confident steps with the opposite side. You're so much more protective of that right side. So
Yeah.
you're paying attention to what the right side is doing. You're really not paying attention to what the left side is doing.
It makes sense.
And that's where people will strain or hurt or stumble or fall. And I'm not saying that that's why you hurt yourself. Yours could be purely coincidental, but that's what we see. Something as
Yeah.
simple as that. And then the second part of that is that you don't get a chance to rest it, because to do any kind of movement, you have to be on your feet. Stand, walk up and down stairs, in and out of your vehicle, driving, everything requires you to be on your feet. So there's no time to rest or recover. And this is where, having that evaluated, making sure you understand the profile, how irritable is it? What can I do? What should I not do? Is extremely helpful.
yeah.
In the right situation, yeah, if you laid down and took it extremely easy and had everything brought to you, yeah, you could heal from an injury like that safe in
Yeah,
3,
but we
4,
all
or
don't
5
have
days.
Dave's life, so
But-
Is that what this is? Okay.
Wait a second.
He's spoiled, isn't he?
I know he's very
guess.
spoiled.
I didn't know
Yeah.
he's able to do that at work. Wow, Terrence. you have a position opening up?
I know people, if you're listening to this podcast, make appointments with Dave so he doesn't lay down and take naps in the room on the side.
I have not done that.
No, he's not. No, Dave's been pretty busy seeing all these folks with these calf and ankle
Yeah,
injuries.
yeah.
But so one of the things we want to look at if we're assessing an injury like that is, okay, what is your daily routine like? So not just, we know that you're training for this, and this, but in the meantime, do you actually get a chance to rest that ankle? So are you someone that's on your feet all day long working on a factory floor, or do you have a little bit more of a sedentary position where you're in an office? Now, if you're sitting a lot, we'll give you advice as to, is there a better way to sit, to position your foot, your ankle? As you just said, sitting just the wrong way can really jack up your symptoms. So a lot of what we can do can just be from advising you what to do or what not to do, let alone just getting in there and then, moving things around and doing some of the deeper tissue stretches. And so with that advice, the problem is that there's so many people out there giving you advice, right? Who do you listen to? And we try to really push the envelope to maximize or optimize your function while still controlling the integrity of the injury. So, Mitch has been through this with us as we kind of pace him through every step of an injury. Like, hey, okay, here's what you can do now. Here's how you're going to do that. Here's what you need to do to support your foot or ankle, as you recover from this. There are specific things that can really help support that and make things feel a little bit better. So, the word again to folks listening to the podcast is you got to pay attention to your injuries, whether they're primary or secondary, and get to the right people. We're happy to see you at PT Sports Pro, but get to anyone that can listen to what you're doing, what you're dealing with, what you're going through, and then how best to address that. Because there is always something that can be done that can give you a more optimal recovery in a shorter time length than having to ride out an injury.
That was the biggest thing for me for coming in was, first you tortured my calf.
You're welcome.
But did you die?
Right. I sent the video that was kind of funny, and that's what it felt like. But on my own time, that's been the biggest thing though, is I've been able to stretch it differently than what I was. I've been able to, and I did realize that after you pointed it out and beat the crap out of my calf, it was tight, and I needed to get that released.
Mm-hmm.
And then I've been working on it on my own and just making sure that I'm stretching that out, because that is pulling on that tendon hard.
Right. And our system, it's not just our body doesn't just work in a silo control pattern, right? So if you're dealing with something at your foot and even down to your toes, it's controlled by the next segment up and the next segment up from that and the next segment up from that. So with all these overlaps in tendons and muscles, you need to address the whole system, not just where it hurts. Well, it hurts in my foot. Why are you stretching out my calf? Well, Here's the reason why. And we do spend a lot of time educating our patients about those injuries and where they could be stemming from, and what happens if you address one versus the other.
Yeah, I try real hard to talk to people right away about that, get ahead of it, because if I go right to your calf, I know what I need to do or what the purpose is of what I'm doing, but the person is undoubtedly going to be like, well, what the heck? I keep telling you it hurts down here. And so that's very, very important.
Education is key. That's the other part that we really try to make sure that when you're working with the right clinician, they should be helping you understand what's going on. Not just diving in or just giving you a quick sheet of exercise. Just do these stretches and you should be good. It's like, no, listen. Even if you know what the answer is, listen, hear out your patient and see. You don't know where that could end up.
Yeah.
I'm working with a patient right now who, he has some hip issues that he's been dealing with, and he on the good days when he walks almost normally. You can't tell that there's any issue going on, but when he's having pain in his hip, it's like just a very noticeable limp. And so I saw him just this last week, and I'm like, let me double check what your leg length is so that we can see if there's any asymmetries at your pelvis, or are we measuring anything that's different right versus left. And when I measured him, he was a centimeter shorter on the side that he was having issues with. But because he's a younger athletic individual, he has figured out how to compensate past that until his body is tired enough and it cannot compensate anymore.
Yeah.
So to most people, he would look normal. And if you didn't look, you wouldn't notice, that there's anything wrong. You would just, okay, let's address the hip, which is actually what I did do on the first visit. Because he actually was having a good day when he came in. It was the second time when he wasn't having such a good day that I noticed that, wait a minute, there's more going on here. Let's double check this.
Well, hey, I want to ask this because, I did roll my ankle, but I mean, how do I know as just, a person out there running when I should call you or not? Because for me, I was doing my run, and this is 10 miles into a marathon. I rolled it. I continued a few steps, and I was like, wow, that I could tell that it was more than just a roll, catch yourself. But it wasn't even 10 yards, 15, 20 yards maybe, that I'm like, all right, this isn't so bad that I need to stop. Okay. So the pain went away and it wasn't so bad that I had to stop and sit down, that kind of a thing. Continue on and ran the rest of the race. Now, was I cautious and careful? Yeah, I did. I was paying attention to what happened, got done with the race, came home, didn't really think about it. I talked to my wife. I said, yeah, I rolled my ankle, blah, blah, blah. But honestly, I think I did the podcast
and never mentioned it.
So that's where, when do I know, like, say, I better call on this? I know that's really difficult to put.
No, we have the answer.
Okay.
I'm waiting for you to finish up your question.
All right. When do I call you, Terrence?
Yesterday.
Too late.
No, but Dave, what's your take on that? Because we both have, some things that we like fully agree on, and there are other things that we just handle a little differently. Not that one is better than the other. So I value his opinion and how he would, what he would recommend.
Yeah, totally. Really, in that situation, especially where if you have an injury and it has noticeably calmed down, but then it sort of rears its head, that sort of scenario, if over the next 2 weeks past that point, if you're not noticing that it is getting better on its own despite your training, then I wouldn't expect it to get better without some sort of intervention.
Yep.
Beyond that.
Yeah, and see, I'm a little bit more aggressive on that timeline because for me, as an athlete, ourselves, I don't know if I want to wait that long.
Yeah.
So I would give it like 2 or 3 days where it's like, man, I know I rolled this two days ago, and it was feeling better right afterwards. I didn't call anyone, but it's now 2 days and it's actually feeling a little worse because remember, when you roll your ankle, you're doing a couple of different things. You've got some adrenaline still going because you're out on the course trying to just survive that.
Yeah.
And then also you're continuing to move, and there is a certain amount of movement that is necessary to remove some of the inflammatory products, the over-inflammation that your body is producing. And so during that time, it will actually start to feel a little bit better. It may feel pretty good until you stop moving. And so that stop moving and then starting to move again is where you're like, ooh, that's not right. So I would advise patients that, if you have something like that where it's like, man, it's really painful. Well, what is painful? It hurts when I touch it is different than it hurts when I step on it.
Right.
So if it hurts to touch, but it feels normal, stepping through it doesn't really bother you, then you wait that out.
Yep.
But if it hurts to like walk and you're having to walk a little differently, if you're limping, that's really where you want to reach out to someone. Even if the answer is, hey, just keep an eye on it for a couple of days, I would still recommend find your people.
Yeah.
Right. And Dave and I have been pretty good at, we've always had our cell numbers on our business cards for decades because most of our people, they need us after hours and on weekends.
Right.
And sometimes that quick text message can make all the difference to calming you down and helping you understand what to do versus like just letting it be. And some of the things we try to avoid by having that immediate contact with us is, for example, what's the first thing that people do when they sprain their ankle? What medication do they want to take?
Ice.
Medication.
Ice it.
What
Ice or ibuprofen.
Oh, ibuprofen or a painkiller.
Right,
Yeah.
Right. So see, and you both said ibuprofen. Now, ibuprofen is not something you want to take within 24 to 72 hours of that first injury. And the reason for that is that if you take it right away, it's going to reduce the inflammatory response of your body. That's what ibuprofen does. It manages inflammation. You want inflammation to occur. That's a natural thing to help your body heal. It's the over-inflammation that's the problem, which is why after that 72 or 48 to 72 hour period, that's where it's like, I'm starting to notice some swelling now. Your body's not doing a good enough job to clear it naturally. That's when an ibuprofen can help. However, the immediate thing that you can do if you're having pain is at least start off with some Tylenol, because the acetaminophen can actually help reduce some of the pain, but it's not going to take it away like a Norco would. It's just going to reduce it enough so that you can function a little bit better and not be as uncomfortable. Because if you are uncomfortable from an injury, you're either going to move less, right? Or you're going to you're going to avoid things, right? And if and in that sense, you're also going to use different muscles to try to create the same movement.
Yeah.
And then you get into this compensatory patterns, and by the time you end up seeing someone further down the line,
Like
you've created a
Like
bunch.
Mitch.
Yeah, no one we know at this table. So this is where I'm a lot more like aggressive.
Yeah.
In like, you have our numbers. Reach out to us.
Yeah.
And a simple text. I mean, the phone calls really, it's harder to address those.
Yeah.
But the text messaging seems to work really well. And I often will tell my whoever's reaching out to me, if you don't hear from me, within 12 to 24 hours, just reach out again, because I do get a few texts and I try to respond to that. And case in point, I was working with a really good college athlete, and she was doing really well, and then she texted me, like I think 2 weekends ago, saying, "Hey, I did this workout and now I'm noticing this," and she knew right away, "Hey, I need to reach out and like at least," and she said, the pain I'm feeling is like a 3 out of 10. But,
Okay.
but I'm just letting you know, like, if there's anything I need to be doing differently, let me know. And so I'm like, well, let's just talk about this. So I actually called her, found a time where it worked. And as we talked through it, I'm like, maybe there may be a little bit more going on. So come into the practice. And that's why I wanted to talk to her, because it elevated it to the next level of, this is not something I can now respond with just a text, because it wasn't making full sense.
Yep.
So then our goal is not to bring every single person into the practice. As a matter of fact, our goal is to keep you out of the practice
Right.
as much as we can, which is why we make ourselves available. And so by bringing it in, we were able to figure out a few things that was a little off from the way she was training and what she was doing. And we just addressed those things, and she's already doing better. So this is where, again, that initial, when in doubt, call or text someone, get a hold of someone. But I wouldn't wait more than 2 weeks.
I'm in that. I will say this, for me, I was I was waiting a few days, see how it was. And I had no pain.
Mhm.
And I was in my mind, moving normally. So just so you know, I felt pretty good. I went
Yeah.
for a run, like, I don't know, 3 days after, and it was fine.
Right.
It was just, I did feel it that one day that I sat in the chair. That's when I noticed. And I
Right.
did probably sit in a way you would say, well, you fool, why'd you sit like that?
Right.
Yeah. It was stretched out to the outside.
Classic,
and,
right? Doctor, why does it hurt when I do this? And we're
Yeah.
like, just stop doing that.
Don't do that.
Right, exactly. In the context of that, exactly. That's what, you strained the tissue there that was injured. And so it could have been, sort of not knowing or having hindsight, it could have been a 50-50 where you irritated it, but it calms down in a couple days or even less. And then you continue running, no asymmetries or problems with your running. Or the flip side of that,
Yeah.
it doesn't happen that way. And if it doesn't, then you're not going to improve just by continuing to run.
Absolutely. And don't get me wrong, I don't want people to be calling me at the first sight of an injury either.
Yeah.
It's like, oh my gosh, we just went for a run. This is what happened. I'm like, well,
Yeah, totally.
How does it feel? Does it hurt right now? No, it doesn't hurt, but I just thought I should tell you. I'm like, noted.
Yeah. Well, you would have been my first call.
Noted, but not remembered.
Yeah. No, but I always advise our patients to pay attention to their bodies again. This time of the year, we're moving a little bit away from our normal training plans, right? So let's say you're supposed to do a 10 mile and a 12 mile and a 14 mile run. And it's all of a sudden, you're taken up by family life. And all of a sudden you're like, well, I don't have time to do that 10 and 12, but I'm just going to jump to my 14 mile run. Never a good idea, right? So look at your plans, listen to your body. And if you do something like, hey, we're going to go water skiing today, and you're out on the water for several hours, and then you have a long run that afternoon or the next day, adjust your plan a little bit so that you don't build up. Give your body some time to recover.
Right.
And then what does recovery look like? The recovery is not just stopping the activity, but it's being intentional about, how you're fueling your system, whether it's electrolytes, whether it's the right food, nutrition, hydration. I mean, it's summertime. We all have that extra cocktail or two. So make sure we're drinking enough water to kind of balance all of those things out.
Yeah.
So, to kind of like wrap up this conversation in terms of what we're doing over the summertime and how we need to change gears.
I'm not quite ready to wrap. I have two things I want to ask that are related to this. And the reason I ask this is because I feel like I can have a tendency to do this. Is you mentioned we're in this, where we're at in our training season or session, over use, over training, like you just said, I'm instead of doing 10, I'm going to do 14. How often are those injuries popping up? Right, especially right now where we're like, oh no, I'm behind, I need to catch up, and things like that. What are some things that you can say to that?
The simple adage that we've always preached over decades and still holds true today: injuries are caused by doing too much, too fast, too soon. So if you can just try to like level that curve a little bit, you can keep yourself out of quite a few injuries.
Awesome.
Adding things like warm-ups and stretches are important. Adding other cross-training things like some weight training, some yoga, core drills are important, even if you're just a runner, because you're not just a runner. You're still using your entire body to propel yourself through the air to get to your goal. So keep that in mind as well as you kind of get through this kind of training season. Yeah,
everything is about balance, really. It's what that alludes to. And so if you are going through your training through the summer and you say, oh, like I feel really awesome, I want to hit this week hard, whether it be higher intensity or longer intervals or longer duration, then just recognize that you really should do the diligence of easing off, even if you still feel good the following week, or plan for that relaxation or recovery relative to what you've done. Because, you don't know that you're going to have an injury until you have an injury. Yeah. And so if you say, oh, I felt phenomenal, I'm going to do it again, or I'm going to like increase, or I'm going to just get through this block, then you may be okay, but you also may be setting yourself up for that injury. So you're not going to lose anything by getting a little more recovery to balance.
Yeah, and in terms of the balance as well, make sure you maintain a healthy mental balance through this time.
True. Yeah.
It's easy to beat yourself up for workouts missed or for performance not achieved, but that's, there's other things in our lives that are going on that we have to accept that creates the balance. Yeah. We should celebrate the fact that we do get to exercise and work out and run and swim and bike and do all sorts of crazy things. And we do get to enjoy nature and other races in different states of mind. And so I think it's important that we at least acknowledge that as well as we move forward with this rest of this beautiful summer.
Yeah. Cool.
So on that note, is there anything else, Lewis? Before we wrap up,
I wanted to ask that because the old overuse, and I love that you said too much, too fast, too soon.
Yes.
Yeah.
Well, ladies and gentlemen, another episode of You Don't Know What You Don't Know, and if you don't know, ask the question, and you will.
Now you know.